the nursing staff are exhausted. It's either the number one or number two risk to each healthcare organization across the country because the numbers are staggering. Right? If you look at the expense for traveling nurses compared to FTE nurses, it can be 4 times the expense. And if you look at the number of nurses necessary to run a health system, you times that increased enhanced hourly rate times that number of individuals, and you can break a health system very quickly. And so this is a number one problem, I think, for many health systems across the country. In terms of the solution, I'm kind of breaking it up into 3 main components. The first, of course, is we have to shorten that delta between what we need and what we have by virtue of hiring more FTE nurses. And that includes doing things that we haven't done before or haven't done in a long time. So, for example, many new nurses coming out of school, they need practical solutions to their work-life balance. So childcare, right? I think about housing. Housing prices is really high in our area, surprisingly. And so are we going to work with our community leaders to be able to add more space for folks? So we need to work on that whole hiring component. It's not just about the dollars per hour. It's really about enhancing that whole experience of living here and working here. But then the other piece I think needs to be looked at in addition is our workflows. So we need to really pick apart our workflows to identify which pieces can be done or have to be done by a RN and which pieces are appropriate for a different level of credentialing. And then lastly, technology, of course. Is there a way to leverage technology to pull things off the plates of nursing staff? Our current ratios are set at their normal historical workflows, which includes tons of documentation, manual documentation. The other piece that's huge, of course, is patient sitting. So frequently across America, when somebody gets admitted to the hospital, sometimes they need to have a nurse sitting there with them while they're hospitalized. And some places have instituted telesitting. So that's really where you have one person who can look at 17 different individuals and communicate effectively with nursing staff if there's something that happens. So there are technological solutions that I think can bring to bear good solutions for this issue, but it's on a case-by-case basis.